Hello friends, welcome back to Complete Medical Coding. Today let's discuss few guidelines and mock questions from Cardiovascular chapter, okay? Both CPT and as well as ICD. So if you are new to the channel, please support me by subscribing to the channel. Let's move to the episode. Let's move to the questions one by one, okay? Let's move to the first question. For a patient of 36-year-old male, aortography and bilateral extremity angiography were performed. The physician placed the catheter in the aorta at the level of the renal arteries and injected contrast for the aortography and repositioned the catheter just above the bifurcation for angiography of the lower extremities. What CPT codes are reported? So here, what are the procedures done? Aortography and angiography. Aortography and bilateral extremity angiography. Okay, these are the procedures done. So this is what we need to code here. And then physician has inserted a catheter in the aorta. Where the physician has inserted the catheter? Insertion of catheter in the aorta. That also you need to code. And then injected contrast means using ultrasound guidance. That is what it is called. Sorry. That is what it is called. Contrast. Injected contrast for aortography. Okay. So if we can see go to the options one by one, we can see the options. In all the options, there is one CPT code which is the same 36200. Okay, so you don't have to look, you don't have to search for, or you don't have to waste time looking in that code. But you can just you need to know what exactly that code is, the description is. Okay, 36200 is introduction of catheter into aorta. That is the CPT code. So that procedure, that insertion of catheter code is already marked. Now you have to code for the contrast for aortography and angiography procedure. Okay. What is the next CPT code? 75630. In the first option, the next CPT code 75630. What does it mean? What is the description? Aortography. Yes, we need to code for aortography now. Okay. So aortography abdominal plus bilateral iliofemoral lower extremity catheter by serialography, radiological supervision and interpretation. Here in this code description, it is mentioned aortography abdominal plus, so along with abdomen and bilateral iliofemoral lower extremity. Is this the iliofemoral lower extremity which is mentioned in the question? No, right? This is angiography of lower extremities. So aortography is only for the abdomen, not this combined code, abdomen plus iliofemoral. No, that is wrong. Bilateral, we need bilateral angiography. So that option is incorrect. What is the next code in option B? 75625 and 75716. What is 75625? Aortography, abdominal by serialography, radiological supervision and interpretation. Yes, aortography abdomen only we need. We don't have that other combined code as mentioned in 75630. So 75625 code is correct. Aortography of the abdomen. Abdominal aortography. Okay. Now, see, that's what is mentioned in the second sentence. If we can see, the physician placed the catheter in the aorta at the level of the renal arteries and injected contrast for the aortography. So that aortography part we have already coded. And repositioned the catheter just above the bifurcation for angiography of the lower extremities. Now you have to code for the angiography. So let's see. Since this is the physician itself has done the procedure, we are coding it with, appending it with modifier 26, technical component. Professional component. Modifier 26 is professional component, whereas TC is technical component. So here, since the physician itself is doing the procedure, we are appending it with modifier 26. Now what is 75716? 75716 again. 75716 is angiography extremity. This is what we need. Angiography extremity bilateral, radiological supervision and interpretation. Yes, bilateral extremity angiography. This is what we need. Also professional component. So append with modifier 26. So we got those codes also, 75716. We can see in the third option, same 75625 and 75710 is mentioned. If you want, you can just check what is 75710. 75710 is angiography extremity, unilateral, radiological interpretation and supervision and interpretation. See, 75710 and 75716, if you can see, 75716 is the bilateral code and 75710 is the unilateral code. But they have, in the option, it is marked with modifier 50 for representing bilateral. Actually, that is also correct. But if there is a combined code, you should always use a combined code, combination code. Okay. Since bilateral code is already present, you can't use the 75710. Description wise it is correct, but you can't use the code because since in the question is bilateral and there is a combination code 75716, you have to use that code only. So 75716 is the correct answer for angiography procedure, bilateral. Okay, if in the question it is unilateral, you can go for 75710 without any modifier, only 26. So here, since the combination code, you need to use 75716. So we got the correct answer as option B, 36200 for the insertion of catheter into aorta, 75625 with modifier 26 for iotography procedure, and 75716 with modifier 26 for angiography of bilateral lower extremity. Okay. Now let's move to second question. A 38-year-old patient's blood pressure was progressively trending downwards, and it was determined that an emergent central venous access was needed for fluid resuscitation. A non-tunneled catheter was used to access the subclavian vein and secured into place to infuse medication. Due to the patient's low blood pressure and anticipated need for vasopressor agents, a radial arterial line was also desired. The left radial artery pulse was easily palpable and the skin was punctured by a needle and the angiocatheter was placed in the left wrist. What are the CPT codes for this encounter? So what procedure is being done here? Central venous access, central venous insertion of central venous, non-tunneled catheter insertion, and then radial arterial line was also desired because of the low BP. So in the last sentence, they have just mentioned how the procedure is being carried out. The left radial artery pulse was easily palpable and skin was punctured by a needle. Then angiocatheter was placed. All these are just how the procedure is being carried out. So let's move to the options one by one. Okay. What is the first CPT code? 36555. The first option, 36555. Insertion of non-tunneled, centrally inserted central venous catheter younger than 5 years of age. Here the patient is 38-year-old. So 36555 is incorrect. What is in option B? 36556. Age 5 years or older. Yeah, above 5 years you need to use the code 36556 for the insertion of non-tunneled centrally venous catheter. Okay. So 36556 is what we need. First let us find out the insertion of catheter code. What is in options C and D? 36558. 36558 is insertion of non-tunneled. 36558 insertion of tunneled centrally inserted central venous catheter. No, we need non-tunneled. So that is incorrect. And what is 36569? 36569. Insertion of peripherally inserted catheter. That is also wrong. So as in the question, it is non-tunnel catheter which is there in only one option, 36556, which makes your answer as option B, right? See, in less than 2 minutes you can find the answer for this question, because non-tunnel catheter is the the code which is there in only option B, 36556. This is how you can save time in such questions. Okay, so don't go for finding out all the codes in a single option, then moving to the next option. It will not save time. First, if you are finding a non-tunnel catheter code, find that code. From that, you will get the answer as option, the correct option. Okay. So here the correct answer is option B. But still we will just, if you got the answer, still you need to check the, you should always cross check the other codes, whether it is matching, whether that question is mentioned in, whether that code description is mentioned in the question or not. Anyway, let's move to that code 36620. What is 36620 in option B? 36620. Arterial catheterization or cannulation for sampling, monitoring or transfusion, percutaneous. Arterial catheterization. Yes, C. Due to the patient's low BP and anticipated need for vasopressor agents, a radial arterial line was also desired. Radial arterial line was desired. This means angiocatheter, arterial, see the left artery was, pulse was easily palpable and skin was punctured by a needle and angiocatheter was placed in the left wrist. So the catheter was used. Arterial catheterization is a procedure here. Angiocatheter since it is mentioned. So 36620 is the correct one. If we can see the other code 36640, anyway it's incorrect, but still I am just explaining what is 366. What are the other codes for arterial catheterization, for coding arterial catheterization, which is mentioned in the question? 36625 and 36640. 36625 is cut down. The same arterial catheterization cut down, it is mentioned. No, since in the question it is mentioned the skin was punctured by needle. Punctured by a needle, it is percutaneous. Okay, wherever it is in the question, if it is mentioned, the procedure is being used by a needle or needle has been inserted into the skin, it means it is a percutaneous procedure. Percutaneous injection or percutaneous is a procedure, not the cut down, as in 36625. And what are the other codes? 36640 and 366, sorry, only one code. 36640 again, it is cut down. Arterial catheterization for prolonged infusion therapy. This is for prolonged infusion therapy, chemotherapy, cut down. Anyway, this is not cut down, this is percutaneous, since the needle has been placed. So, as mentioned, the correct answer is option B, 36556 and 36620, which is for arterial catheterization, 36620, and 36556 is for the insertion of non-tunneled catheter. Okay. Now, third question. A 55-year-old patient had 90% stenosis of the right coronary artery and underwent a coronary artery bypass grafting. You may get it as short form also, CABG. Okay, coronary artery bypass grafting, requiring a single arterial graft procured from. So, how this single arterial graft has been taken out? Procured from the internal mammary artery. Okay, internal mammary artery. And single vein graft procured from saphenous vein. What CPT codes are reported? This question you should listen to the question carefully. Now for examination, you can easily find the answer because options are there. But if you will go to some, go for some interviews or other examinations, or interviews, or if you are going for a job, you will not get these options, right? You will have to find the answer for the codes. So always you should check, you should listen. What is the question? You should listen, understand what is the procedure carried out. Okay. So here what are the procedures carried out? Underwent coronary artery bypass grafting. So here a CABG grafting was performed. But how it is performed? How that CABG grafting has been done? Requiring a first one is single arterial graft procured from artery, internal mammary artery. So single arterial graft from artery and single vein graft procured from saphenous vein. So you have to code for both, right? Single artery from the mammary artery and single vein from saphenous vein. So let's move to the codes. Let's find out the codes. And this is not a multiple procedure. If you can see in the options, in two options it is mentioned modifier 51, which represents multiple procedure. This is not a multiple procedure. It's a single procedure carried out from two different, one artery and one vein. Okay. So what is 33533? First option. 33533 represents coronary artery bypass using arterial graft Single arterial graft. Yes, the first one we need is single arterial graft, which is the code 33533. What is the second one? 33517. 33517 is coronary artery bypass using venous graft and arterial graft, single vein graft. Yes, single vein graft list separately in addition to primary procedure. Use 33517 in conjunction with 33533 because this is an add-on code. So CABG grafting using venous graft with single vein graft. This is what we need, 33517, right? You can see in the other options, other codes, 33510 is there. What is 33510? Coronary artery bypass vein only. Single coronary venous graft. That's the wrong code, not vein. This is artery. Now what is 33518? Two venous graft. That is also incorrect. Here it's only saphenous vein, one vein. So, as mentioned, you already got the correct answers. Option B, 33533 for coronary artery bypass, single arterial graft, and 33517 for single vein graft. Okay, no need to use any modifier 51 because this is not a multiple procedure. So, option A is incorrect. Option B is the correct one. Okay. Now moving to the fourth question. This 67-year-old man presented with a history of progressive shortness of breath, mostly related to exercise. He has had a diagnosis of secondum atrioseptal defect. See, in this question it is clearly mentioned. He had a diagnosis of atrioseptal defect for several years. Means he was having this problem. He was already diagnosed with atrioseptal defect. Okay. And has had atrial fibrillation intermittently over this period of time. He was in atrial fibrillation when he came to the operating room, and with the patient cannulated and on bypass, the right atrium was then opened. A large 3 by 5 centimeter defect was noted at fossa ovalis, and this also included a second hole in the same general area. Both of these holes were closed with a single pericardial patch. What CPT and ICD codes are reported? So here, what is the diagnosis? Atrioseptal defect. Atrioseptal defect. And that defect was there since long time. And now the patient is here for bypass. The patient cannulated and on bypass, the patient was, yes, right atrium was opened. That is a procedure. Right atrium, opening of right atrium and repair of right atrium, and then both the holes were closed with pericardial patch. Let's see. Let's move to the code. First, let's find out the ICD code. What is Q21.0? You have to find the ICD code as atrioseptal defect, right? What is Q21.0? Q21.0 is ventricular septal defect. So that is wrong. What is R06.02? That is shortness of breath. R06.02 represents shortness of breath, which is present in the question, but that is only a symptom. If we if we can't conclude or if we cannot confirm any diagnosis, then only you have to use the symptom. But here, since we already have the diagnosis as atrioseptal defect, you have to go for that code, which is Q21.1. What is Q21.1? Atrioseptal defect. Q21.0 is ventricular defect and Q21.1 is atrial defect. That is what our exact diagnosis is. No need to code for shortness of breath. So, option A and B is incorrect. We got the ICD as Q21.1. That is the only diagnosis, which is in options C and D. So, now we can go for the procedure from C and D. Should be either 33641 or 645. What is 33641? Repair of atrial septal defect. Yeah, repair of the atrial defect. Right atrium was opened. So, repair of atrial defect. Secondum with cardiopulmonary bypass with or without patch. In the question, it is with patch using single pericardial patch. And what is 33645? Direct or patch closure sinus venuses with or without anomalous pulmonary venous drainage. No. The correct procedure is repair of atrial septal defect, which is 33641. which makes our answer as option D, right? 33641 for the atrial septal defect, second term, okay, with or without patch, and the diagnosis Q21.1, atrial defect, atrioseptal defect, okay. Now let's move to fifth question. The cardiologist advances a 6 French catheter into the left renal artery via a right common femoral puncture. So catheter is inserted, okay. That's a procedure here. It is selectively catheterized and angiographic films are taken. The catheter was then removed and a diagnostic guiding type RDC catheter was used and the left renal artery was selectively engaged. A 0.014 supracore wire was used and the lesion was crossed. A 6 by 18 mm balloon expandable razor stent was introduced. So stent is also inserted. This was expanded around 8 atmospheres of pressure, which is nominal. Angiography revealed excellent results with no residual stenosis. What CPT codes are reported? So here catheter is inserted into the left renal artery and then later a stent was also introduced. Anyway, let's move directly to the question, to the options. First, let's find out the option for the answer for the code for catheter placement. Okay. What is 36245? The first option. 36245. 36245. Selective catheter placement, arterial system. Each first order abdominal, pelvic or lower extremity artery branch within a vascular family. Arterial system only it is mentioned. Okay, left renal artery, arterial system. Which artery it is not mentioned. Anyway, let's move to the other code in option B. 36251. What is 36251? See, we have insertion of catheter codes starting 36245, 36246 and 36251. From these three you have to find the answer first. Then you can from this 3 you have to find the code, then you will easily find the answer. So 36245 is selective catheter placement, arterial system. Each first order abdominal, pelvic or lower extremity artery it is mentioned. What is 36246? Initial second order abdominal, pelvic or lower extremity artery branch. Initial second order abdominal. No, it's not initial second order abdominal. It's not mentioned. In the question it is left renal artery, which is the main artery. And what is 36251? Selective catheter placement, first order, main renal artery. Yes. And any accessory renal artery for renal angiography, including arterial puncture and catheter placement, fluoroscopy, contrast injections, image post-processing, permanent recording of images, and radiological supervision and interpretation, including pressure gradient measurements when performed and flush iotogram when performed unilateral. Whatever we need and doesn't required, it's all there in the description. But you have to always check if whatever we require, it's there in the description. Okay, 36251. C. Selective catheter placement. Yes, this is a catheter placement. First order artery, because this is a left renal artery mentioned, it's a first order artery, main artery. Okay. Then including arterial puncture and catheter placement. Yeah, this is catheter placement. Fluoroscopy. Fluoroscopy is also mentioned, right? See, diagnostic guiding type. The catheter was, selectively catheterized and angiographic films are taken. It means fluoroscopy guidance has been, it's also there. It's also included in the procedure. Then right common femoral puncture. That is also mentioned in the question. Femoral puncture. See, where it is there in our code. Including arterial puncture. Yeah. Including arterial puncture and catheter placement. Both are there, which is there in the question. It is already marked. So we got the correct answer. Right? The correct option as option B. Still, let's look into the other code. Since this is a left renal artery, you have to append it with modifier LT, because it is in the code, it is just mentioned first order main renal artery. It doesn't mention left artery. So you have to code it with modifier LT. And what is 37236? Along with that code 37236. 37236 is transcatheter placement of an intravascular stent. Yeah, stent is also placed, right? That also you need to code. except lower artery, for occlusive disease, open or percutaneous, including radiological supervision and interpretation, and including all angioplasty within the same vessel when performed initial artery. Yeah, this is initial artery, means only one artery, left artery, and catheter transcatheter placement of an intravascular stent. Yeah, this is the same stent. I mean the same the procedure that we need. Open or percutaneous, including radiological guidance. Angiography is done, so including the radiological guidance, everything is there in this code, in the CPT code 37236. So you got the correct answer as option B, 36251 with modifier LT, which represents catheter insertion into left renal artery, and then 372364 the stent of the main artery. Okay, if you have any doubts, you can mention it in the comments. I will reply to you. I know it's little difficult to understand, but for few people this will be easy. For few people, few chapters are easy. For few people, radiology will be easy. Some people lab will be easy. Some people see cardio will be easy. It depends on people how easily they can understand that concept. Okay. So this is what few questions from the cardiovascular section, and I'll coming back with more and more questions. If you find this video useful, please like and share. If you have any comments, please don't hesitate. You can mark it in the comments, and I'll be replying back to you as soon as possible. If you are new to the channel, please subscribe to my channel. And thank you so much, friends. Stay tuned for more videos. Bye. Take care.